The top 6 vitamins to reverse hypothyroidism. Hypothyroidism refers to a condition characterized by an underactive thyroid gland that fails to produce and release sufficient hormones. This deficiency in hormone production can lead to a slower metabolism, weight gain, increased sensitivity to cold temperatures, hair loss, and other related symptoms. Essentially, the thyroid gland, which is situated in the neck and has a butterfly shape, plays a vital role in the body by producing hormones such as T3, T4, and calcitonin. These hormones control various aspects of metabolism, including digestion, heart rate, breathing, body temperature, bone mineralization, and many others. Experiencing low mood and persistent fatigue are common symptoms associated with hypothyroidism. Additionally, some individuals may develop noticeable vertical ridges on their nails. If left unaddressed, an underactive thyroid gland can lead to the formation of nodules and goiters, resulting in the appearance of a lump on the neck. In severe cases, this condition can progress to a life-threatening state known as myxedema coma, which causes a slowdown and dysfunction of the body's internal organs. Studies indicate that in 90% of cases, hypothyroidism is caused by an autoimmune disorder called Hashimoto's. When undigested proteins, such as gluten, enter the bloodstream, it can cause inflammation and activate the immune system, which mistakenly identifies the thyroid gland as a threat. This can result in damage and inflammation in the thyroid gland. Other factors, such as an impaired liver function or insufficient intake of nutrients like selenium or iodine, can also contribute to this condition. In this article, we will explore 5 vitamins that can aid in repairing the thyroid gland and restoring the proper hormone balance of T4, T3, and calcitonin. Additionally, we will discuss simple lifestyle modifications that can address the underlying causes of thyroid issues. In this context, the term vitamins encompasses a wide range of minerals and nutritional supplements that can help in the restoration of the thyroid gland. It is important to note that this video is solely for educational purposes and should not replace medical advice from a healthcare professional. If you have any concerns regarding your health, it is advisable to consult with your doctor. Number 1 is selenium, 200 micrograms. To enhance the health of your thyroid gland, taking a 200 microgram supplement of selenomethionine or selenocysteine once daily is recommended. Selenium is a vital trace mineral that facilitates the conversion of the inactive thyroid hormone, T3, into its active form, T4. Taking a supplement can accelerate the conversion process for those with an underactive thyroid, hypothyroidism. Research indicates that selenium supplementation can lower thyroid antibodies, TPOAB and TGAB, thereby preventing the immune system from attacking the thyroid and exacerbating the condition. Women, in particular, are more susceptible to hypothyroidism, particularly after pregnancy, which can be due to hormonal imbalances, including high or low levels of estrogen. Selenium can help balance these hormones by promoting liver health and increasing antioxidants in the body, such as glutathione. Number 2 is bile salts. Did you know that the majority of thyroid hormones, about 80%, are actually converted in the liver, rather than in the thyroid gland itself? Simply taking thyroid medication may not address the underlying issue, which could be related to the health of your liver or gallbladder. Factors such as a fatty liver, gallbladder stones, or toxin buildup, like mercury, can cause inflammation and hinder the conversion of thyroid hormones. To improve liver health, you might consider taking bile salts as a supplement, which can be taken in the form of 2 capsules before each meal. Bile salts can help to thin out the bile in your liver, which can activate the conversion of T4 to T3. Additionally, they can aid in the removal of toxins, like mercury and other heavy metals, as well as harmful chemicals from your diet that could be irritating your thyroid. If you find this information helpful, please consider liking, subscribing, and turning on notifications to stay up to date on the latest health and nutrition tips. Number 3 is vitamin C, complex. If you are experiencing an overly active immune system, it could be due to damage to the lining of your gut, also known as leaky gut. This can occur as a result of consuming grains and flour products such as bread, pizza, popcorn, cereal, biscuits, cakes, and pasta, which contain a protein called gluten that can harm the intestines and cause holes to develop. These holes allow toxins to leak into the bloodstream, which can trigger inflammation and other health problems. Because the protein structure in the tissues of your thyroid is similar to gluten, your immune system may begin to attack the thyroid, mistaking it for a foreign invader, such as a virus or pathogen. To address this issue, you may consider taking a true vitamin C complex that contains bioflavonoids, which can boost collagen in the body and promote healing of the gut lining. Acerola cherry capsules or fruit powder blends are a good source of vitamin C, but it is important to note that over-the-counter vitamin C supplements that only contain ascorbic acid are not effective in healing the gut because they only contain 5% of the true complex. To obtain the full vitamin C complex, it is best to consume foods such as cabbage, sauerkraut, strawberries, bell peppers, and cruciferous vegetables. Number 4 is iodine and zinc, trace minerals. Trace minerals are crucial nutrients that are required in small amounts to facilitate thousands of chemical reactions performed by various enzymes in the body. Selenium is a trace mineral that can help reduce inflammation by eliminating free radicals produced during the synthesis of thyroid hormones. Zinc is another important mineral that plays a critical role in thyroid hormone synthesis. Iodine is a key raw material necessary for the production of T3 and T4, the thyroid hormones. Incorporating seafood such as sea kelp, nori, kombu, Irish moss, mussels, clams, crab meat, and oily fish into your diet 2 to 3 times per week can help you obtain more of these trace minerals. You can also take liquid trace mineral drops, 20 drops daily, mixed in water, and sea kelp capsules to increase your trace mineral intake. These trace minerals also aid in maintaining healthy skin, hair, eyes, and nails by supporting the thyroid in regulating cell growth, division, and collagen production. Number 5 is vitamin D3 and K2. To help regulate hormones and reduce inflammation in the thyroid gland, it may be beneficial to take 10,000 IU of vitamin D3 per day along with 100 micrograms of vitamin K2, 7 Malawian kwaches. Vitamin D plays a critical role in modulating and controlling the immune system, preventing it from attacking the thyroid gland accidentally. Research indicates that individuals with hypothyroidism frequently have a vitamin D deficiency due to insufficient sun exposure or inadequate synthesis in their bodies. Functional doctors may prescribe higher doses of vitamin D3 to treat autoimmune disorders like Hashimoto's. Additionally, vitamin D improves liver function by balancing hormones and eliminating harmful substances that could trigger inflammation in the thyroid gland. Number 6 is magnesium. Magnesium plays a critical role in the conversion of T4 into T3, improving the body's capacity to utilize thyroid hormones. Let's delve into the underlying causes of hypothyroidism. Grains and gluten, as mentioned earlier, can damage the gut lining and trigger an autoimmune response in the thyroid gland. Another contributing factor is the consumption of deep-fried foods and inflammatory vegetable oils, which can harm the intestines and liver and lead to inflammation and toxin accumulation. Liver disease can also impede thyroid function since 80% of thyroid hormones are converted in the liver, particularly if one is overweight. Finally, prolonged mental stress, overtraining, or menopause can cause cortisol levels to become elevated, signaling the thyroid to produce fewer hormones. Iodine/selenium deficiency. Not getting enough iodine or selenium through a healthy diet can hinder the body's ability to synthesize thyroid hormones. Medications. Certain medications such as statins, diuretics, and antibiotics can also weaken the thyroid by causing hormonal changes. Lifestyle tips to overcome hypothyroidism. Knowing these causes, let's explore X lifestyle tips to improve the health and function of your thyroid. Eliminate grains, vegetable oils, and gluten from your diet for at least 90 days. These include bread, popcorn, canola/soy/corn oil, cereal, biscuits, pasta, tortillas, and rice. Help restore your gut lining by consuming bone broth, raw garlic, kefir, sauerkraut, and low-glycemic berries. Incorporate anti-inflammatory organic foods such as steamed broccoli, cauliflower, leafy greens, radishes, celery, and Brazil nuts. Include pasture-raised eggs, wild salmon and sardines, grass-fed beef, organic pork, and shellfish to your diet to obtain trace minerals. Avoid low-fat diets as your body requires certain fats to make hormones. Include virgin cod liver oil, pasture-raised egg yolk, and grass-fed butter as excellent sources of retinol, active vitamin A, which activates certain thyroid receptors. If you're experiencing high levels of mental stress and tension, it may be beneficial to try ashwagandha capsules or lemon balm tea, which are natural adaptogen herbs that can help lower cortisol, stress, and estrogen levels that could be contributing to a hormonal imbalance. Additionally, you may want to consider taking some of the supplements mentioned in this video, such as bile salts, which can improve the conversion of T3 to T4 in your liver. Look for products that contain bile acid factors, bile salts, ox bile, or TUDCA, as they can help cleanse your liver and intestines of toxins and undigested proteins. Another important tip is to start practicing timed eating, where you consume all of your daily calories within a 6-hour window and fast for the remaining 18 hours. This can trigger autophagy, which can reduce inflammation, calm an overactive immune system, and prevent future thyroid problems. Thank you for watching, and I hope you achieve great health, wealth,